The U.S. Supreme Court just ruling on the president's vaccine mandates.
We begin with that ruling. It was a split decision. The court has blocked the president's vaccine mandate for private businesses. But the court is allowing the mandate requiring most healthcare workers to get the shot to stand. That business mandate went into effect last week, and several businesses have already started enforcing it. This week, Universal told workers they would either have to be vaccinated or test weekly. We reached out to them to see if that mandate will stay, but we have not heard back. As for the healthcare mandate, it is one reason why hospitals are dealing with staff shortages right now. And now some places are trying to fill the gaps by letting workers with COVID keep working. Let's get out to Fox 35's Holly Bristow. She is live tonight with the latest. Holly.
Hi, Luann. Well, I have called all around our area to the major hospital systems, and I haven't been able to find any place that's happening here in Central Florida or even in Florida. But if you're traveling or have loved ones in other states, this is definitely something you want to be aware of.
Since sick, I think it's terrible.
Yeah, I think that's not a very prudent idea.
That's the reaction Fox 35 News got from Central Floridians learning that healthcare workers in California, Arizona, Rhode Island, and the country of France who've tested positive for COVID-19 can continue to work if they are asymptomatic or have mild symptoms.
Like everybody else, if they have COVID, they should be quarantined. And I understand there's a shortage, but yeah, I just don't know if we want to put sick people around people who are coming in sick.
LaShawn Cole had COVID back in the summer of 2020 and spent a month in the hospital. He thinks it's ridiculous a healthcare worker would be asked to work dealing with the virus themselves.
I would feel sad for them. I would thank them for their service, but I also be like sad that that they have to come and help me. It's not fair to those doctors and those nurses.
Willa Ford is the executive director of the Florida Nurses Association.
You know, we're sort of bound by our professional duty to protect patients. And so, right off the bat, I'm going to say that sort of breaches that trust.
Fox 35 News reached out to Central Florida's largest hospital systems. Only Health First got back to us, declining discussing the broader issue, saying, however, quote, as an integrated delivery network or system, Health First is fortunate during critical times of need to have the ability to redeploy talented clinical resources to areas where we most need them. We, in fact, experienced this firsthand during the Delta spike in summer 2021, when many of our non-hospital clinicians volunteered to serve in one of our 4 Brevard County hospitals. Becca sharing she's gotten COVID-19 twice, both mild cases, and says that's the only time she'd be okay if her healthcare provider had COVID too.
If I had COVID and they had COVID, sure, whatever.
And that's how they're treating things in the state of California. Any healthcare worker who does have COVID-19 that's treating patients is only allowed to treat patients who currently have COVID-19, and they still have to wear an N95 mask. For now, reporting live in Seminole County, Holly Bristow, Fox 35 News.